सब्सक्राइब कीजिए ध्येय आईएएस चैनल को और बेल आइकन को दबाइए लेटेस्ट वीडियोस सबसे पहले देखने के लिए।
The Ministry of Health and Family Welfare has recently released the results from the first phase of the National Family Health Survey (NHFS). It is the fifth such survey, and for the first phase data was collected in the second half of 2019. The survey provides detailed information on population, health and nutrition for states and union territories. It was conducted after a gap of 3 years. The first set of findings were released for 22 states and union territories, which together are home to almost half of the country's population. It includes big states like Maharashtra, Bihar, and West Bengal, but does not include the country's most populous state, that is Uttar Pradesh. In this DNS, we will be talking about the findings of this survey and about NFHS. Let us first begin by talking about NFHS. NFHS is a large-scale nationwide survey of representative households. The data is collected over numerous rounds. The Ministry of Health and Family Welfare has designated International Institute for Population Sciences in Mumbai as the nodal agency, and the survey is a collaborative effort of IIPS, 𝐼RC-MACRO, Maryland, US, and the East-West Center, Hawaii, US. The survey is funded by the United States Agency for International Development with supplementary support from the UNICEF. This is the fifth NFHS and refers to the 2019-2020 period. The first four referred to 1992 to 1993, 1998 to 1999, 2005 to 2006, and 2015 to 2016 respectively. The initial fact sheet for NHFS-5 provides state-wise data on 131 parameters. These parameters include questions like how many households get drinking water, electricity and improved sanitation, what is the sex ratio at birth, what are infant and child mortality metrics, what is the status of maternal and child health, how many have high blood sugar or high blood pressure, etc. In every round, NFHS has also expanded the scope of inquiry. In the fifth iteration, there are few questions on preschool education, disability, access to a toilet facility, death registration, bathing practices during menstruation, and methods and reasons for abortion. The NFHS data is possibly the most important one because it not only feeds into the research needs and informs advocacy, but also is central to both center and state level policy making. NFHS survey results also provide internationally comparable results. That's because the questions and the methodology is internationally valid. The second phase of the survey was disrupted by the COVID-19 pandemic. Its results are expected to come out in May 2021. The second phase will cover some of the bigger states such as Uttar Pradesh, Madhya Pradesh, Punjab, and Jharkhand. Experts expect the second phase data on child malnutrition to be even worse, given the all-round adverse impact of COVID, be it personal income, food availability, healthcare provisioning, etc. The most important takeaway from the first phase survey is that between 2015 and 2019, several Indian states have suffered a reversal on child malnutrition parameters. In other words, instead of improving, several states have either seen child malnutrition increase or improve at very slow rate. As per the fifth National Family Health Survey, mortality rate among infants and those under 5 years of age fell in 18 states and union territories out of a total of 22 that were surveyed. While 16 of them registered a rise in the percentage of under 5 children who are underweight and severely wasted, 20 states and union territories have recovered a rise in the percentage of children under the age of 5 years who are overweight. Sex ratio of the total population rose in 17 states and union territories. The neonatal mortality rate dropped in 15 states and union territories, while the infant mortality rate and the under 5 mortality rate fell in 18 states and union territories. Researchers and experts on the health and welfare metrics have described the latest results as shocking, alarming, and very troublesome. On various parameters, the number of states worsening over the last round, that is NHFS-4, is not only high but often more than the number of states improving. The most troubling thing is that on child malnutrition parameters such as infant and child mortality, child stunting, child wasting, and proportion of underweight children, several states have either been stagnant or worsened. Particularly, children born between 2014 and 2019, that is 0 to 5 years of age, are more malnourished than the previous generation. The reversal in the proportion of children who are stunted is the most worrisome because, unlike wasting and being underweight, stunting represents chronic malnutrition. Reversals in stunting are unheard of in growing economies with stable democracies. Lastly, let us know about the significance of these results. Worsening child malnutrition as well as rising levels of anemia in women points to Indian children born in the past 5 years likely suffering from both cognitive and physical deficiencies. The latest results reveal that, health-wise, India has taken a turn for the worse since 2015, despite improvements in water availability and sanitation methods. Health outcomes like child malnutrition data are the results of a complex set of reasons, ranging from the state of a family's income generation to environmental factors to government interventions. According to the experts, when the full set of raw unit level data is available, then a proper analysis of why India suffered such reversals over the past 5 years can be done.